This video talks about a 54-year-old woman comes to the physician for a follow-up exam. 2 months ago, she was diagnosed with hypertension. Treatment with thiazide was begun at that time. Her blood pressure today is 150, compared with 165 2 months ago. Her serum potassium concentration is 3.2 compared to 4.5 2 months ago. Addition of which of the following antihypertensive drugs to this patient's medication regimen is most likely to further decrease blood pressure and restore potassium concentration towards reference range? So initially, her blood pressure was 165. After 2 months, after using the thiazide, it has dropped to 150. So her hypertension has definitely gotten better. Not anywhere near normal, but it has definitely gotten better. Her potassium today, when we're seeing the patient, is 3.2, which is kind of on the lower range. But when she came in earlier, it was fine, 4.5 2 months ago. Okay, so her potassium situation gotten kind of worse because she's hypokalemic today because of the thiazide. Thiazide is a diuretic and sometimes it can get rid of electrolytes. So that's why her potassium has dropped. Now the question is asking, addition of which of the following antihypertensive drugs to this patient's medication regimen is most likely to further decrease blood pressure? So we want to give another drug. Addition of which of the following antihypertensive drugs. So we want to give an antihypertensive drug to this patient's medication regimen, which will further decrease the blood pressure because thiazide alone is not enough because it's still 150 over 100, and restore potassium concentration towards normal reference range. So we want to kill two birds in one stone. So when we look at it, they're all antihypertensive, right? So we have to pick the one which is actually going to cause hyperkalemia. And from the list, the first drug that comes to my mind, the diuretic that comes to all our minds, is spironolactone, right? Those drugs is going to cause hyperkalemia, or it will increase the potassium levels in the serum. But in this particular question, when we look at all of them, we can see that atenolol beta blocker really has no effect on potassium levels. Furosemide will probably decrease. It's going to cause hypokalemia, which is going to make the situation worse. Nifedipine is a calcium channel blocker, has nothing to do with potassium. Prazosin is an alpha-1 blocker. Again, it has nothing to do with potassium. Losartan is the only drug which actually causes hyperkalemia. Okay, so in this, it's also an antihypertensive drug. So Losartan in this particular question is the perfect choice. In fact, Losartan causes so much hyperkalemia that sometimes it has to be monitored for having too much having too much potassium in the blood and causing other kinds of problems. So the answer in this particular question is going to be Losartan.